There are two most frequently asked questions of me after birth of premature baby by parents. The first one is, will my baby live? Will my baby survive? I will talk about answers to that question in another video. In this video today, I want to talk about second question, which is when my baby is gonna come home, when you're gonna discharge my baby. Of course, there is no quick answer to this question, but in this video today, I will talk about criteria that we take under consideration before we can make decision to discharge baby home from NICU care. As a reminder, I'm Dr. Wiśniewski and this is my YouTube channel Neoped Edu. On this channel, I talk about health issues affecting population of premature babies, full-term newborns, and infants up to 1 year of age. Let's get to our topic of the day. I will go over the list of 10 criteria that we take under consideration whenever we make decision to send premature baby home with its parents. Number 1. Baby should be able to maintain its normal body temperature in open crib. If you ever visited NICU or if you are a parent of premature baby in NICU right now, you probably have seen that a lot of newborn babies are placed in plastic boxes. We call those plastic boxes isolates or incubators. When baby is placed in isolate, we can regulate very easily temperature of the air in that box, so baby's body temperature remains normal. Abnormal body temperature when exposed to normal room air, it's a very common problem for premature babies. Their brain doesn't know how to regulate very well their body temperature, and also they don't have enough energy resources right after birth if they are very, very small and if they were born very prematurely. So prior to discharge home, we have to make sure that baby, when it's placed in open crib, normally clothed and covered with normal amount of blankets, that this baby's body temperature is always normal and it's not a problem. Number 2, each baby prior to discharge should have regular breathing pattern. A lot of premature babies suffer from what is called apnea. Apnea is defined as a short pause in breathing. Babies don't breathe for 20-30 seconds, and that can happen for a number of reasons. It might be due to immaturity of the brain, some bleeding in the brain. It might be due to feeding problems or immaturity of their neurological system or some obstruction in the respiratory tract. We have ways to treat it when baby is in NICU, and one of the treatment is a medication called caffeine. However, when we send that baby home, we want to make sure that baby does not have apneas anymore, or baby doesn't have at least significant clinical apneas. Number 3, baby should have regular heart rate pattern. And again, premature babies may have slowdown in their heart rates below 80 per minute. Normal heart rate for premature babies, usually it's somewhere between 100 to 160, but for most babies, we might say that down to 90 or 80 per minute, it's still safe. However, prolonged slowdown in heart rate below 80 per minute is not considered safe, and we don't like sending those babies home. Number 4, baby should be able consistently gain weight. Obviously, most premature babies, if not all premature babies, are born small with low birth weight. And the most important for them is to start gaining weight after a couple days of life and continue gaining weight after they are sent home. For those tiniest babies who are born as micro preemies or extremely premature babies, it is very difficult to start gaining weight initially. And it takes a long time to gain enough weight so it is safe for them to go home. We don't have actually exact weight criteria to send babies home. Usually, they are all other functions mature around the time when their body size actually is good size to be sent home. And that usually happens at 3.5 to 4 pounds of weight when those babies acquire other functions so it's safe for that baby to go home. Number 5, if baby is on oxygen, the oxygen requirement needs to be stable, so we don't need to keep changing amount of oxygen that we deliver to that baby from hour to hour. It should be safe to send that baby home on set level of oxygen and then, let's say, check on that baby once or twice a week, sending nurse to home and make sure that levels are appropriate. Number 6, if baby is sent home on NG feedings or G-tube feedings, parents need to learn how to do it and need to be comfortable with doing it. Some extremely premature babies or micro preemies, when they mature, still they don't learn how to eat very well by mouth, and they require tube feedings. Occasionally we do send such babies home with those tube feedings, and we have to teach parents how to do it and ensure that they feel comfortable with that feeding procedure. So, of course, that needs to be completed prior to discharge home. Number 7, if baby is going home and it will need some kind of equipment, such as already mentioned, oxygen, nasal cannulas with oxygen, oxygen tanks, monitors, tube feedings, dressings for the wounds, or anything else at all, we need to make sure that we ordered everything, that all the equipment was delivered to parents' house, and parents were taught how to use it and they feel comfortable with doing it. Number 8, all blood tests and imaging studies need to be steady enough or normal, so we don't have necessity of repeating them very frequently. It wouldn't be ideal situation to send extremely premature baby home and have it come back for different tests every day, every other day. So we want to make sure that all testing that was necessary or urgent, that it's done, and we don't have further need for frequent repetition of those tests. Number 9, we have to ask all subspecialists involved in care of that baby whether it's okay to send that baby home. Before discharging baby home, we want to make sure that all subspecialists signed off on that decision and they are comfortable with all what they've done, with all treatment plan after discharge, and they gave us recommendations whether they want to have follow-up and see that baby after discharge in their clinics. And finally, number 10, the parents, family members, and caretakers need to feel very comfortable with taking care of that baby. Ideally, if you are a parent of premature baby, you've been visiting often your baby, you've been involved in care of your baby, so you are comfortable with feeding your baby, giving bath, changing diapers, taking temperature, giving any necessary medications, and in those situations when we sending your baby home with tube feedings or oxygen or any other type of equipment, you should have learned by now how to use it and feel comfortable with that. If all that is true, usually it's a time when you can take your baby home. So that concludes 10 criteria that most neonatologists would take under consideration before making decision to send your premature baby home. If you have any questions, please write them down in comment section and I will try to answer those questions or address them in my other videos. If you like this video, please click like button. And as always, if you are interested in any other topics that relate to neonatal population or full-term newborns or infants up to 1 year of age, please subscribe to my channel. Let me know what kind of topics you would like me to talk about in the future.